Good evening, everybody. Welcome to this Instagram Live. I hope you're well. I hope you've had a good day. I'm super excited to have with me today Dr. Veena Babu, who's going to be talking a little bit about her balance between medicine and her career as a dancer. Some of you guys might have seen Veena's video. She's got a huge following on YouTube, huge follower on Instagram herself, and I'm super happy to have her on board. Welcome to everybody who's joining us. Hi guys, how are you doing? How's your day? Give me some feedback. Hi, Veena's on board. Let me see if I can add Veena in. The request of Veena. Hopefully she'll join us in a second. Thank you so much for everybody who's joined us. I can see some names that I recognize. Hi, Alex. Hi, Andrew. How are you doing? Good to see you too. Hope you guys have had a good day. I'm not sure where you guys are tuning in from. From the names, I can see most of you guys seem to be in the UK. Someone from Brazil. Fantastic. Hopefully Veena is there. It says waiting, so I'm sure she's on board. Let me know how your day was, guys. What you've been up to? Were you working? Were you off? Are you preparing for an exam? What are you guys up to right now? And what time is it, guys? Some of you guys are saying you're from all across the world, so let me know what time it is, and thank you for tuning in if it's an odd time. How you doing, Alex? Good to see you. Hi, Narona. Hi, Zara. Birmingham. Fantastic. Hi, Maya. Hi, Med Hustler. Love the name. We're talking about hustling today. We're talking about how you, hi, man, how you doing? We're talking about, I'm writing an essay. It's fantastic. We're talking about how to do something on the side. Oh, it says Dr. Veena is unable to join. Hopefully we can add her in. Hi, guys. Finished on call. Hi, Jeremy. How you doing? Hey, Veena.
Hi. Sorry, can you hear me?
Yes,
Good.
How are you?
I am good. How are you?
You were looking super smart for an IG live.
I came home and had to wash my face. I finished work at 7. So I felt
what were you doing today?
I was in clinic. I had a 9 to 7 day. Yeah.
GPing. I need to put my volume up so I
GPing.
can hear you a little bit better.
GPing. Yeah.
Good. Now, for those of you who don't know, Veena is a GP and finished when? GP, when did you come out of GP training, Veena?
Guys, I'm such a brand new GP, fresh out of the box. I finished in October.
October, okay.
Yeah.
So everything is fresh. You know everything right now. All the guidelines are in your head.
Yeah.
It's all still there, right?
Yeah.
Yeah, good. Well, thank you so much for taking time out, because I know you're doing lots and lots of things and you're very, very busy. And I think this is going to be quite useful for people just to understand how you can balance two things, because you, for those who don't know, you give it the introduction in a second, but Veena does a lot of stuff around Bollywood dancing and basically being an entrepreneur and running a company, as well as obviously now being a GP, but previously a junior doctor, going through the various stages. So we're going to tap into a little bit of how you did it all and how you managed it, because there are lots of people out there who do lots of amazing things, and some find it very easy to balance and to do everything together, and some find it really difficult. So we're going to find a bit about how you coped and a bit about your journey. That's okay.
Thank you. Firstly, Aman, thank you so much for having me on here. You know how much respect I have for you and how much I look up to you. So it's an absolute privilege. So thank you for having me here.
Thanks, Veena. And we did an interview, for the guys who don't know, we did an interview about your exams about a month ago, didn't we? So if anyone hasn't seen that, just head to our YouTube channel and watch that, because some super important stuff about how to get through exams. But this is all about dancing. So just give me a really brief summary then as to when it all began, how you got into it, and where you are right now with all.
Okay, so I am a trained dancer, and all throughout med school, I did as many dance shows, competitions, represented, the university, even before actually going to university. So I went to King's and Imperial, but even before that, in my gap year, I ended up representing the UK in a dance reality TV show in India. So it was always kind of in the background, and I used to be a freelance dancer for lots of different dance companies throughout med school, where you'd get jobs, you'd get booked on, you'd audition. If you got the job, you got the gig, like a part-time job. And then I finished med school, became an F1 in August, and you know how it is, the hours, the madness, it was a bit overwhelming, and I felt like something was really missing, and I didn't know what it was. And I was placed in Northampton, so I wasn't in London. The base was kind of far. So I decided to start a YouTube channel and call it IV Dance, because I wanted it to reflect what I do for a living, dance running through your veins. So IV, that's why.
I see. I wondered where that came from.
Yeah, that's where the idea came from. And it was just a channel as to be a creative outlet more than anything. Did one video every couple of months. It wasn't consistent. It wasn't a planned, thought out process at all. It was just kind of a release a creative release. And I think a lot of people can relate, where if they're musicians or writers or directors, you know, there's some kind of a release you need before you go back into like an intellectual setting. And then the second or third video went viral. And after that, opportunities just started coming. And I was like, I may be onto something here, because there clearly seems to be a demand. And it got to a point where I was getting approached by brands that I've only, you know, never dreamed of working with, like Sony Music and Tips and recently Dove. And that's how it all started. And then I think over the last 5 years, I didn't have a point of reference, Aman, you know, because when I was in med school and started out, everyone, and I mean everyone, would ask me, so when are you planning to stop? So when are you planning to stop? And I always thought, you know, would you ask me this if I was a man? Would you ask me this if, I don't know, you know, and I feel like it almost shaped me into thinking, you have to stop. So it was almost like, okay, try and do as much as you can in a few years, and then get it out of your system, and then on to the next thing. Because there was no point of reference. There was no one that I could look up to who was doing these things. And then after F1, F2, I made it quite a big purpose of mine to openly talk about the challenges of working in medicine, studying exams, making it to the studio, training, you know, videoing, and competing with people who are like full-time performers, or, you know, dancers and artists. And I have so much respect for them and so much respect for the craft. I just felt like a lot of younger people needed to see a point of reference. And that's literally, my whole inbox is full of that now, where it's either medics and dentists and scientists and pharmacists, everyone saying, oh, I didn't think this was possible, but it is. It obviously is. And all of a sudden, they don't feel like they have to give up their passion. Instead, it can help mold you into a better kind of clinician, or it can mold you into a better whatever professional field you're going into. So that's pretty much a synopsis of how it went. So it went from YouTube to workshops to then traveling, then brand collabs, and now I feel blessed enough to be in a position where I can try and pick and choose what I want to invest my time in.
That's a lot of things there you said that I'm going to pick up on, because there's a lot of interesting things there that I think are synonymous across many doctors who do different things. Like, yes, you're doing your Bollywood dancing, and that's your thing, and there are lots of people doing other things, and I think there's a lot of crossover in terms of the challenges that people come across, the doubts that people might have, the questions that people might come up and ask you. So that's really interesting. I want to talk about some of those things as we go through. But so what was first then? Was it medicine or was it dance? Just clarify.
So it's funny because I didn't get into medicine first. So I took a gap year. In the gap year, I ended up dancing in that competition. I left the competition in quarterfinals because I got my med offer. And now 10 years later, I'm kind of, I don't know, it's a love affair. I don't know what to say.
So hold on a minute. So you did this reality dance show here, or you traveled to India?
No, it was in India. So I was representing the UK. Yeah.
Wow.
This is my gap year.
And you got to the quarterfinals and you had to say, see you later. I've got to do medicine.
Because I got my offer at King's and it was starting, and they wanted me for 2 more months of filming. So I just made a choice to leave it. Yeah.
Okay. So then you start med school then. So King's, wasn't it, you said? And when did you first do dancing in med school? Did you find a dance society? Okay, did you create a dance society, find a dance society? Because there's so many of these out there now. But was there one at King's already? And did you?
Oh yeah. There was a huge range of things at King's, and I think London being such a metropolitan city, so many different cultures. So it wasn't even just our Asian culture, but it was also, you know, the Afro-Caribbean society. I'm Christian, so there was gospel society where I kind of did faith-related dance and creative messages and stories. So there was so much. There was so much. Yeah.
Okay. So did you find it challenging from the beginning to do both, or did you find it pretty easy to start with in the early years of med school?
No, it wasn't challenging. I think it's because it was about priorities, isn't it? I think I told myself I can never fail an exam. That was my thing with myself in med school, and I never did. So when it was time for exams, 8 weeks before that, I wouldn't be doing anything else. But then throughout the year, I would try and do as much of things as possible. So it was about prioritizing, time blocking, and just knowing at what point in the year what's more important to me. Yeah.
And so it's interesting. You said that you thought that you may not do this for that long. So you're trying to cram it all in as much as you could in med school.
Yeah, because everyone told me I shouldn't. And my family thought I was crazy. ex-partners, you know, boys I've dated were like, so when you're planning to stop, you know, what's going on? And I was like, if everyone's saying it, there must be some truth to this. Like maybe I need to stop. So I was almost conditioned into thinking I needed to stop.
Okay. So that's one first year, second year. What about clinicals? When you started clinicals properly, how was it then? Were you still managing to keep up with everything?
Yeah. So I
And
think it's quite a trend now as well. A lot of the younger lot, because there's so many competitions, and I think they're
yeah.
placed around your exams. So they're not near your exams. They're kind of, you know, you have a bit of time. So I think universities know what everyone's weak points are.
Yeah. And what were the reactions back then? So think about, yeah, I don't know, tutors. Think about, I don't know, you're on a ward round as a med student. Like, did people A, know what you did? And B, if they
No.
did, what were the reactions that came?
No, they didn't. And
Okay.
I liked that. I liked that my worlds didn't collide, you know. I liked that when I'm at work, I'm just at work and I don't need to entertain anyone or try put on a show. It was a different kind of a performance, right, as clinicians. And when you're in the studio, when I'm with my students, it's a different kind of persona of your personality that comes out. Because obviously in a clinical setting, you need to come across as someone people will trust. You know, I can't be as playful and, you know, all of that. But if I'm honest with you, Aman, a lot of the medical community were very, very interested, and a lot of them were very like, oh, that's so unique and interesting. I don't know anyone who does that, or I don't, you know, it was more positive from all of them, if I'm honest with you. So even in med school, I got asked to go and film something in India a few times, and the choice came up of, should I take another year out? Should I, you know, because the head of year said, we can give you 3 weeks. That he was like, that's a max we can give you, but if you take longer than that, you have to repeat the year.
Right.
So then I had to give that up. I said, no,
Wow.
I'm not repeating the year.
Okay. So at that point, when push came to shove, medicine took the priority. Like you didn't.
Because I wanted to finish it. Yeah.
Okay. And I guess you thought that you wouldn't be carrying on with dance forever, probably, I presume, at that point. So when did you first realize, actually, you know what? I don't need to give it up. Like, why do I need to give it up? When did that first realization happen?
If I'm honest with you, it was somewhere along GP training where I didn't dance for a good few weeks, and something was just wrong. I can't put it into words, you know. I wasn't functioning to the level I was. I felt like I wasn't as happy inside. I definitely wasn't as agile and, you know, energetic as I am normally. And I just felt like something was just missing and I couldn't put a finger on it. And then I ended up in the studio and I thought, oh my God, I feel like as long as I physically can, I should try and I should encourage others to.
Yeah.
And I think, especially with what we do as GPs, there's such an emphasis on chronic disease and the power of movement. You know, dance is one facet, I think, but even just movement and encouraging people and getting them excited about moving again, you know, even if it's up and down your stairs or carrying a bit of weights. So I really feel passionate about that now. I just feel like we're so blessed to have bodies and have joints and be able to stand and walk. And yeah, I just feel really passionate about it.
And now, you're trying to spread that message, I guess. And I wonder if you are combining both worlds, really, aren't you? What you do in medicine and trying to bring in your passion and almost gel the two together in some aspects. So, okay, so you have your clinical stuff and you have your dance stuff. When did you first start teaching others? Because it's one thing to do things on yourself or a passion and a hobby and whatever in med school. When did you first realize, actually, you know what, I want to help others and start teaching people?
Yeah. So remember the years when I was freelance teaching and performing in my teens? So from the age of 17.
Okay.
So I was part of dance companies in London.
Right.
And I was teaching classes from then. So all throughout uni, my side job alongside retail would be teaching dance, teaching first dance choreographies, private weddings, you know, high profile shows with like singers and performers, that kind of thing. So it was always for another company or another entity. But it was after becoming F1, I decided to just do my own thing.
Okay. So that's when you set up
Yeah.
IB Dance.
Yeah.
And then when you set it up, did you envision that it's going to be where it is now, or did you envision it would happen that quickly?
No, it definitely wasn't quick, and I still don't think it's anywhere big.
Okay.
I think this is the thing, when you're trying to do two things, the growth is not as exponential, and you're trying to achieve success in both areas, and there's only so much you can give. And especially with last year, I didn't release a single video on the channel because the priorities were passing exams and, you know, everything else. So it was a big shift of where is all this going to go? Where am I going to take it? So it was a lot of decisions on my side, but
Yeah.
so it definitely wasn't quick.
Okay. Fair enough. And I guess, yeah, you're talking 3, 4 years, maybe 5 years, isn't it?
Yeah,
The,
5 years.
growth. And
Yeah.
you probably, like most things, had periods where it sped it up and then slowed down and sped up
Yeah.
and slowed down. And I guess you based that around, like you said, exams and that sort of stuff. But how did dance help you through the stressful times? Because it's, going through 7 years of medicine and then exams and training and GP training. There are stressful times and exams and things like that come up. Did dance help you in those times?
Yeah, definitely. So it's a form of expression. It's a form of release. It's a form of almost meditation and synchrony and poetry, right? I feel like whenever I had anger or sadness because of whatever personal things were going on in, family or home or my parents' illnesses, once you're in that studio and you create, it's like you take it out of you and you put it in that piece, and then you leave it there and then you move on. So it was a very therapeutic experience for me, if I'm honest, creating pieces and releasing it and kind of seeing where things go.
Yeah.
And I wasn't even planning to do workshops and teach, but then it was when people reached out to me saying, can you please teach us? Can you please do? And I was like, you know what, actually I should. So that's where it went from. Yeah.
If you say, just choose one of them, say someone said, you know what, Vina, you could
No,
do one.
you can't.
No,
No,
just say,
you can't.
what do you think? Like, is it
No,
50-50? Is it an impossible thing? Is it always going to be both?
I don't know. I'm figuring that out. I honestly have to be honest, because last year I felt like I wanted to give medicine the attention and the time it deserved, and I
Mm,
had to put dance in the backseat because I thought you have to practice what you preach. So if I'm telling everyone else to prioritize things at different points in life and I'm not doing it myself,
mm,
and I don't regret it for a second, because I absolutely enjoyed finishing training and, starting my GP career in kind of sound mind of what I'm doing. And now
mm.
that I'm a little settled into it, I can focus a bit more on the creative side.
Yeah.
Yeah,
And you've earned that right, haven't you? Because now being a GP, you can decide a little bit more about, what days you're going to do clinical and what
yeah,
days you're going to put something else. Was, I guess, through training, a lot was dictated by the 5 days or, on calls, etc. And
yeah.
how did you kind of just keep things ticking? Was there a period where you thought, you know what, I can't do both? Was there ever a point where you thought this is too much and maybe I need to
No,
let one go?
no,
It was
no.
always
I
it was
think,
always there.
yeah, and I think if I'm honest with you, I'm sure you understand this better than anyone. If you want to do something, you will make it happen. So it got to crazy points where after a set of 3 nights or 4 nights, we'd go straight to location to shoot something, or after a 12-hour shift, you'd meet up somewhere to like choreograph something or perform or produce something. And now in the year that I didn't produce anything, I look back, like the opportunities that are coming now, I
Mm,
feel like they're coming because of all the work I put in at the beginning.
mm,
And so when a lot of the younger, students and people come and ask me, what should we do? What, I'm doubting myself. Am I good enough? And all these things. I was like, just start, just stop talking, just
mm.
start and just keep going. And the
Yeah.
rest will follow, isn't it?
Yeah,
Yeah.
yeah, yeah. So yeah, and two things really important actually. Start, don't think too much and just jump in because you'll figure it out. You don't have to have it
Yeah.
all figured out at the beginning. But secondly, be strong enough to say, well, actually, I can have 5 months off. And it's not that I'm going to lose this other thing that I love doing. It's going to be there when I come back.
Mm.
And that's sometimes quite hard for people to do, when they kind of worry about, well, if I stop it, will I lose it, or will I lose enjoyment, or will I lose the traction, whatever it might be.
Mm.
And therefore maybe you almost do it because you feel you have to. Whereas what you're saying is that I was able to very clearly say, well, actually, this is not the time now for this. I've got this in front of me and I've got to focus 100% on this. But this will be in the future. My dance will be there and I'll come back to it whenever I feel. And it sounds like you didn't have that pressure that you had to kind of maintain both
No, the pressure was
forever.
there. Yeah, the pressure was there, but I think you just have to make a choice, isn't it?
Yeah, yeah.
But when you asked me, did tutors and medics judge you, or what did they ask you? More than them, I'll tell you who do judge you. When you go on the creative field, say, there were a couple of projects where I was on a song shoot or a movie shoot, and the professional choreographers there and the dancers there, they don't take you seriously because
Mm,
they're like, oh, she's not even serious about dance, she does it part-time. Do you see
yeah,
what I mean? So
yeah.
when you go to that field, they don't take you as seriously. So that's
Wow.
where you really need to prove yourself. Whereas in medicine, it makes you interesting. Oh, you do
Yeah,
dance, you're interesting. As
yeah,
long as you're
yeah,
good with your clinical work and you're getting on with it, you're
yeah,
fine.
yeah, yeah.
But I think it's when you try and make it in the other side, it's like, oh, but what does she understand about, you know, arts and, you know, the struggle and everything? Yeah.
Oh, wow. Okay, interesting. So it was the
Mm.
other side that doubted your ability to do both almost,
Oh, yeah,
rather
yeah,
than the medic
definitely.
side.
Yeah.
Wow. Okay. Okay. But do you remember any negative reactions from the medical side? Any kind of thoughts as to why you're doing that? Why are you wasting your time? Like, it's just dance, like, you know, or maybe people who thought that you weren't serious about medicine.
Uh, no, everyone kept saying to me, why are you in medicine? Leave and go.
Okay. Okay.
Honestly, consultants, supervisors, everyone kept saying, go and do that and come back to this. And I was like, no, I need to finish this.
Yeah.
And this is the honest truth because, you know, I had to be realistic about it. You know, I think we've had this conversation before. I couldn't be putting content out on the internet where I'm dressed a certain way or doing certain dance moves because I'm aware my patients will see me. And there has been, you know, points where I've had patients in clinic and the mother had seen me dance, and, you know, one or two times people recognize you if they're South Asian and they watch these things. But so that's obviously at the back of your mind. You want to put things out to a certain standard, or, you know, it always has to be kind of a little bit respectful, I think, in
Mm,
some degree.
mm.
But that was about it. But that was my own pressure.
Okay.
But that's the truth, actually. Yeah, because even
Wow.
in SD training, I thought, should I? Because opportunities were coming for certain projects, and I thought, should I take a year out of SD training?
Mm,
But all my supervisors just said, just finish it. It's three
yeah.
years, just get it done. And it was the best advice because now that
Yeah.
I'm
Yeah.
done, it's the freedom is
Mm.
wild.
Well, it's like you said, you've earned that freedom, haven't you? Now
Mm.
you're in a position to decide, well, what do I want to do and when do I want to do it,
Yeah,
as opposed to how do I maybe fit it all in. But
yeah.
really interesting about patients. So patients used to come in and say, oh, look, it's Dr. Veena.
No, it was no, it wasn't. It wasn't. It was in a clinic, and I was a registrar, and it was this woman, and she was like, oh, my son watches your dances, and the son was
Wow.
sitting, and he was so embarrassed, and I was just like, no, let's bring attention back to what we're talking about. So it was funny in that sense, or like when young kids had seen me and they knew who I was. And
Mm,
um so it was nice where you get to share all of that. Or
yeah.
when I have medical students in clinic with me,
Yeah. Yeah.
and they've obviously followed my work, and they're just like, it's just nice to see, because
Yeah.
in the
Yeah. Yeah.
digital world you don't know what, if it's been affecting anyone. So
Mm,
actually seeing them face to face, it's like a visceral feeling. It's quite
yeah.
nice.
Wow. Wow. That's really
Mm.
interesting. And how has one helped the other? So what skills have you learned maybe from dance that helps you as a clinician? And what have you taken from clinical work to put into dance? Can you think of anything that's helped either way?
Oh yes, Owen, the discipline. Come on, the discipline from medicine, and the knack of not giving up. There's always
Mm.
a way. You always just find a way.
So,
um,
so so medicine taught you that for your dance.
yes,
Yeah.
and I
Yeah.
think dance taught me to think outside the box, to be creative, and to understand people a bit better. So
Mm.
now as a GP, a patient may at first say, "No, I'm not going to do this," but I feel like I understand people and relations a bit better. I don't know if I'm, you know, articulating this correctly, but
Mm.
it's,
Mm.
I just feel a lot more confident around people and around emotions, um, to do my job better as a clinician.
Mm.
Yeah.
So you've learned, that's good. So you've taken something from one and learned it in the other, and vice versa. And I think people who are passionate about anything can do that, can't they? They can
Oh
they
yeah,
can
yeah,
mix two things together, and they can make one help the other, and they're not completely separate. Even though you think, well, clinical work's completely
yeah,
separate, but actually there are facets in anything that you can take that can help you in any other field, isn't it?
yeah, yeah.
And when you go to such passion, then things cross over, undoubtedly, even though other people might not realize how.
Yeah, because even now, if you think about it, even on our particular current social media scene, like Rupi's doing, you know, Doctor's Kitchen. He, you know, does the whole nutrition. He's an A&E and a GP, and then there's a food medic. Hazel's doing it. I think there's another young doctor who's a DJ, and he does like NHS sessions, but he's also a doctor at the same time. So he does these DJ live sessions where everyone can come on. And so I think with the current age, everyone's getting a bit more of confidence to
Mm.
kind of own their, whatever their side hustle or passion is, and just
Yeah, yeah, yeah,
enjoying life as well, and not feeling like
yeah.
being a medic puts you in a box and you have to kind of be
Mm.
refrained.
Mm.
I don't know, do you feel like that?
Yeah, kind of. I mean, I'm interested to ask you a little bit more about that in terms of the whole maybe digital side and social media, because
Mm.
you are now available for everyone to watch on social media, and there are a lot of clinicians doctors, and for good reasons, are worried about perceptions
Mm,
and people seeing too much. I've had this question of me all the time, like, why do you put out so much on social media
mm,
about, what you do and family, etc. So how do you balance that? Like, does it cross your mind in terms of, you mentioned it already briefly, but how much do I put out there?
mm.
Or are you just one of those kind of people that, what, we're in this world. This is where we are right now. Why are we so hesitant about doing this kind of stuff?
Yeah. Um, I think it's a fine balance, isn't it? Obviously, when you're in clinic, there is no way I'm on my phone when I'm at work or in clinic. So I have an assistant now. I have streamlined the process.
Very
So
good.
she helps post and do things that need to be done for, ticket sales or when workshops come up and things like that. So I am not on socials when I'm at work. If I do take a photo or something, it might be in between clinics, it might be in my break or something that I want to share with people. Like, for instance,
Yeah,
recently when we were doing the vaccination clinics, I felt so proud and to even be alive to do something like this and serve our community. So things like that, I think, will spread like a positive message.
yeah,
Um, Similarly with dance, I do share behind the scenes of how you create and the struggles and everything. And I think in terms of personal life, with what you said, I guess that is a personal choice, right? Like what you want to share about your other half or significant other or your children. And that I think is your personal choice. But with medicine, for instance, it's not really my choice. It's confidentiality and it's about being professional. It's the whole guidelines. I can't cross that
yeah,
line.
yeah,
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 because it's
yeah,
it's not about, it's at the end of the day, it's not about the numbers and the fame and all of that. I'm a clinician at the end of the day, and that's the priority.
yeah,
So
yeah, yeah, yeah.
yeah.
And that's a really good point. And so I guess what you're saying is, look, you can do both. You can be on social media and be a personal figure and be a clinician and work with the medicine as well. And I think a lot of doctors and clinicians in general are worried about that boundary and how far to push it. But I suppose as long as you're clear about what role is what and what can be shown and what's kind of the rules and what are not the rules and what's personal, I think you can make it work. And clearly you've done that because you're on various channels with huge numbers and people watch you every day. Yet you go into your clinical work and you kind of close box um,
Yeah.
and
But
do
then
it.
there's sacrifices, isn't it? Like I may not be able to reply to every DM that comes through because I'm not a celebrity and I'm not a social media person. There's not enough time to do that because you're obviously working. So now that I have extra pair of hands on board, so all the emails get sorted. Because before I was like, I used to wake up before work for an hour to do social media admin before going to work. And I was getting burnt out. I was like,
Mm,
this is not why I'm doing this. I'm not doing this for this. So I think it's about when you get to that point where you think, you know that gut instinct where it says something's not right. Am I pushing
mm,
too much? Am I sharing too much? You need to step back and
mm.
think, can I delegate this to somebody else
Yeah,
so I
yeah,
can focus
yeah.
on what's important? Yeah.
Yeah, 100%. I mean, without delegation, once you get to a certain level, without delegation, you're going to get burnt out, isn't it? If you're
Yeah,
trying to
you
do 100
can't.
different things. And that's certainly something that came to our point a couple of years ago where I had to decide to leave quite a few things behind if I
Yeah.
wanted to make one thing big. And but at the moment, it looks like you're doing both, which is
I'm
really good.
trying, I'm trying. I
You
think it's
are.
it's
Well,
it's but it's what you said. If you give up something, it's what you water flourishes, right? So
yeah,
it's
yeah, yeah,
you lose some, you win some, and you just have to
yeah,
be okay with that. If you're going to balance two things, you have to be okay that you may not get every gig and you may miss out on some big projects.
yeah,
And
yeah,
if you have exams, do you know what I mean? But
yeah,
that's
yeah,
something you
yeah.
just have to be okay with.
Yeah, and be clear about the reasons why you're doing both, I suppose. And
Yeah.
if that's set and that's right, then everything else will take care of itself. But I want to talk very very quickly about entrepreneurship because obviously
Mm,
you run a company, and you run a company alongside being a clinician. And there's a lot of buzz at the moment about doctorpreneurs and doctors starting side hustles and side businesses. How have you found the entrepreneurship side of it? You've got the dance side of it, which is the passion bit, but you try to turn that into something that can help you financially,
mm.
like all entrepreneurs. How's that been? How have you dealt with that side of things?
Mm, I think I've enjoyed it. It's been a really, really fun journey in terms of making mistakes, learning from mistakes, understanding finances, learning where to hire, how to hire, all of that, and making some tough choices. And especially as GPs, you have to, if you especially because right now I'm a full-time locum GP, you have to be okay with managing your finances and your pensions and all of that. It's part of growing up, and I think overall it just makes you understand things a bit better. So if anyone's going to do it, I'll just say don't be daunted by it. Just get excited by it of how much you're going to learn. Because if you have a USP and you want to monetize it, or deliver something to an audience, you need to have a structure to what you're delivering. Otherwise, it's just not professional.
Yeah, and that's exactly great advice. Jump in. You know, don't worry too
Yeah.
much about the hows and what's and what if and etc. and what people are going to say and am I going to manage it, and you're going
Yeah.
to make mistakes. You know, you're going to make mistakes, but that's the only way you're going to learn. That's the way you're going to improve.
Yeah.
So that's great advice. And if there's a lot of people who think, you know, I wish I could do something else, but how can I? And I don't have the time. And you know, if I have to do something, I have to give up one session. And it's quite a lot of battles that go on internally. And then eventually 40 years happens and they're still doing the same thing as they were. And they thought, I wish I'd done something different. But, you know, there's a lot more GPs and even, you know, further down, foundation year doctors, GP trainees who are starting side things at the moment. And the way of the modern GP certainly is to have this portfolio career, isn't it? And whether that portfolio career means doing something within medicine, which is not general practice, or something completely different, which is what you're doing. But the advice I think is sound that you say, don't think too much about it, jump in, because things tend to work out, and that passion will drive you through the barriers, right? When you fall down and make a mistake, if you love what you're doing so much that you're going to get up and start again. Whereas if you're doing it because it's just, oh well, it's the thing to do, then it's probably not going to drive you through those barriers.
I think definitely don't ride a wave and don't go with the hype. If you're doing it, it has to be with an integral meaning for why. And even if now I'm at a point where even in 5 years, if I stop it or do something else, it's okay, because I know I'll evolve into something else and maybe focus on something else. I think it's getting to that, being okay with what your choices are and just owning it. I think some people are asking questions.
Yeah,
Do you have questions?
I'm so busy with listening to you. I'm missing the clips quickly.
Yeah.
How do you divide your time? What's your normal work week?
So guys, GP is an amazing career where you get to literally design your life. So at the moment, I'm working a lot. I'm doing like 10 sessions a week. So I'm trying to divide my weekends into teaching and training, and at least 2 or 3 times a week, I'm trying to wake up early before work to work out. So that's what I'm trying to do. But I think next month I may actually commit 2 days in the week to just dance and focus a bit more. So I think my answer is it changes. And the beauty is you can keep changing it as you want and as you wish.
Do you have a routine? Do you have a morning routine? Do you get up at a certain time? Is it fixed? Or are you kind of just, let's see what happens?
No, I don't. I'm not going to pretend I do because some days I come back by 8 p.m. You know, if I do urgent care, you're working midnights and nights, and each day is different. And I'm okay with that. I think as long as I tell myself, when you have 0 days where I do nothing, those are the days you switch off and literally do nothing. But every other day, as long as you're hitting your targets, making sure you're rested and fine for work, and then making sure you're up to date with things, I think that's about it. And just enjoying it, isn't it?
Yeah. So you're saying on locuming. So are you long-term locum at one place, or are you doing bits and bobs in different places, different clinics?
I'm working in 3 different practices, so it's different places. Yeah.
Okay.
So the week is very varied and it's very interesting.
Okay.
Yeah.
Okay. But pretty much you're there for 4 or 5 days a week clinically, or is it different from week to week?
It's 4.5 days. 4.5
Okay.
days.
Okay.
Yeah.
Pretty
And
fixed.
some remote work. Yeah.
Good. Got a question coming. What style of dance are you doing?
So I'm trained in classical Indian, but I teach a fusion. So I don't know if you know this, but the urban fusion is called Bollywood. That's why I call it. And the more contemporary one is called Bolly Feels. So it's more Indian classical mixed with Bollywood. Because I've trained a lot in the West and your Indian upbringing, and I just kind of blend it, and that's what I teach. Yeah.
Very good. And so you teach both separately, and you get some people come to both, or some people just come to one or the other?
Yeah, they attract different audiences. Yeah.
And what are you doing through COVID? Are you doing virtual stuff?
Yeah.
Or has it closed down for a little while?
No, I've started Zoom classes. It's just that for now. I'm trying to do just monthly at a time, so we can all just kind of plan month by month and not plan too ahead, because there might be another lockdown and there might be other problems. Yeah.
But that's entrepreneurship, isn't it? Like no one could have predicted this is going to happen. Yeah. But if you love something so much, you'll find a way to do it. Like we've had to change everything completely. There's no, you came to our face-to-face course, didn't you, for AKT?
Yes.
That seems like a million years ago. Like face-to-face courses right now just are, I can't even imagine how they used to be. So, but that's just adapting, and it sounds like you've done that for your field as well. And because you love it, you'll make it work.
Yeah.
Are there specific precautions you take with regards to GMC guidelines clashing with your dancing? Good question.
I can't think of any GMC guidelines that I'll be going against. I'm not doing harm to anyone. I'm not portraying myself in an unprofessional manner. I think if anything, the way I have been has kind of encouraged others to become a bit more active. So more than the dance side, I think it's a fitness side. So a lot of my routines are very dynamic, you know, floor up, jump levels, and it's really exhausting. It's a big cardio workout. And I think it's fitness more than anything. And I felt it. I mean, last year when I didn't dance for like 7 months, I felt it. Put on weight, I became weaker. I just, you definitely feel the difference.
There's a question coming about mental health. How do you maintain that with all your commitments?
Yeah. Oh, Mitali, that's a very good question. I think I see it as two things, because we all have, you know, the three masks that they talk about, how you perceive yourself, how the world perceives yourself, and how you think you should be perceived. I think with mental health, you just have to be honest with yourself. If you're doing it to try and meet some kind of expectation or fit some kind of mold that you need to fit, you're never going to be happy, and you're always going to be trying to achieve. I had to learn this the hard way, where I was a perfectionist and wanted everything to be perfect. But then I realized it doesn't exist. It's about just doing the best you can, and then next time trying to be better than your last video or your last class I taught, or, you know, so managing your own expectations and not comparing it with anybody else's journey, because they started somewhere else, you started somewhere else. Yeah, but I think last year even I struggled, because I was very alone. My parents were unwell. My other half is in a different country. I hardly saw him. It was really lonely and tough. But and I'm proud to say
And,
that even. Yeah.
and that coincided with the period that you weren't dancing a lot as well,
Yes,
right? Yeah,
yes,
yeah,
yes. And I was really low, and I didn't know if I couldn't be on Instagram and pretend to be happy and smiley and fake to people, because I didn't have it in me. I was like, this is just a crappy situation. I don't know what else to
mm,
say.
mm,
Yeah, and that was it. And sometimes that's life, right? We don't need to always put on some kind of mask. If times are tough, they're tough. It is what it
yeah,
is.
yeah,
Yeah.
absolutely. And with social media, that's something that often people struggle to do, isn't it? To not put on that mask, to not look like everything's perfect all the time.
I mean, can I
Uh,
ask you, did you ever get judged? Did anyone ever ask?
yeah,
Yeah.
100%, 100%. I mean, and still do like that. That's never going to stop.
Mm.
But it stopped being a problem for me.
Yeah.
Whereas it will always happen. Like people say, oh, you know,
Yeah.
why don't you do this? And now you're doing too much of this and too much videoing and too much X, Y, Z.
Yeah.
And, you know, why have you chosen this and why not that? I mean, that's always going to happen, right? Because people
Yeah.
have opinions and that's fine. But,
Yeah.
and it used to affect me, but once I stopped letting it really dig in to me,
Yeah.
then it became fine. Like I
Yeah.
appreciate the opinions and sometimes listen to them and change accordingly, right? That's being adaptive.
Yeah. No,
And
definitely.
and since when we met for the courses, things have changed so much, and we do complete different stuff to what we did
Mm.
when we met you. So that's just
Mm.
being adaptive and changing. And some of those are because people gave good ideas and opinions that actually were
Yeah.
helpful.
Yeah.
Whereas a lot of it you get negative. The reason I asked about negative comments and criticism is because whenever you go so far into something, you're bound to get naysayers. You're bound to get people who say, well, why? And shouldn't you do it this way? And aren't you doing too much of that? And that's why I was asking about that, to see um, whether you got that, because it's strange for someone to get so far in something and not get those kind of criticisms and naysayers and people saying
Mm.
that you can't do something or you can't balance both or you can't go far enough in both careers.
No, but
Eventually, you're going to have to decide one or the other.
yeah. As in, I've not thought too far about, because there were some opportunities. There were some big media projects that came from India, but I couldn't go because I was in the middle of acute medicine. I
Yeah,
couldn't,
yeah.
and I know the reality of it, but it was just something I chose, you know.
Hmm.
And when you said about the negative, but I did have it, but it was from, I'm going to be honest, it was from my family.
Hmm.
It was my parents who were like, "What are you doing? You're not married. You're just dancing around doing cartwheels. What are you
Yeah,
doing?"
yeah. Well, they're your biggest critics, right?
Yeah,
And rightly so sometimes. Like it's good to hear from them, but biggest critics, yeah. But I would say
yeah,
same with our family. They're like, why are you doing so much medical education? And is it really a career? And don't you want to focus on the real
yeah.
stuff of medicine?
But
So
then
yeah, I think
again,
it's similar.
sorry to interrupt, but I was just going to say that's again with, there was no point of reference, because now you're doing this. The younger generation be like, "Oh, do you want to be like Dr. Aurora?" you know, or do you want to be like that person? Because there was no point of reference before this, who did this on media, right? Because it got to a point where my parents, when we were out at certain places, people would come up and say things to them like, oh, are you Veena's mum, or we've seen her dancing. And I was like, well, no one came and told you about my medical work. You only get recognized because of my dance. And then that's when they were like, oh, okay, maybe what she's doing, you know, we should let her just do her thing.
Yeah. And that's one of the side things that are going to happen when you do something to such a level, and people notice you and watch you and see you on a day-to-day basis, which they do with you, because you know you post a lot and people know exactly what you're doing and when you're at work and when you're not, and that's going to come with it, I suppose.
Yeah.
But I think we've got through some great stuff, actually. I think there's a lot of advice for people who are thinking about jumping into stuff. So let's just wrap up with a couple of final bits of advice just from your own experience. So let's talk about the dancing bit first, and then let's talk about doing something else second. So let's start with dancing first. If someone is interested in dance, has never really done it, or thought, as a doctor, how am I going to find time, or a med student, what do you advise them? How do you get into it? How do you start? Like,
I wish someone told me this when I started, because I had to figure it out. And so if I had a younger person to say this, so I would say, figure out the purpose of why you're doing it. Is it just for your happiness? Are you trying to get better? Are you trying to get skilled? Or are you trying to achieve a certain level? I think when your purpose is a bit clear, your next steps become clear, because you can picture the destination and work backwards. So I think that clarity really helps. You could change the destination afterwards, but if you start just thinking, I want to dance, I'm going to stop going to clinics, I'm just going to go to studios, I'm going to spend all my savings on training, you know, you have to think it out a little bit.
Yeah. That's a great point. Like, why are you doing it? Because a lot of people do something new because of a monetary factor. Like, I want to do this because someone else is doing it and look what they're doing, and it can maybe mean I can do less medicine and eventually I can start doing this.
I was just going to say, there's a lot of money, the amount of money I had to inject into this, like now I'm making the money, but in the first 2 years on an F1, F2 salary, studio hire, you know, it was like 20-30 pounds an hour, then the cinematographer, then the editing. So I taught myself editing to cut that cost. There were so many things you had to do. It's expensive and it's not easy at all.
Yeah. So if the reason that you're going into something, dance, whatever, or whatever it might be, is I want to earn, then you've got to be prepared to put in a bit of time where you're spending.
Yeah.
And only then maybe will you get a chance to get it. But that's where your passion comes, isn't it? When it's the third month, fourth month, and you've lost X number of £100 and nothing's come back in, that's when you really know, okay, am I going to carry on doing this?
Yeah.
Or do I just stop and do something else? And that's why you see lots of people perhaps just do a couple of months of something, then a couple of months something else, couple of months, because that clarity wasn't there. That reason for getting into it wasn't quite right, or it wasn't strong enough to pull them through the inevitable challenges of starting a new side hustle or passion or whatever it is. So that's a great first thing. Make sure you know the reason, make sure you've got a bit of clarity as to why, but flexibility to change, like you said.
Yeah. Don't be rigid, because we're human and we evolve, and change is the only certainty in life. We're going to change, and our needs are going to change, and our wants are going to change. So I think.
And what do you think about like goals? Like, because you must have, you know, work goals and dance goals and entrepreneurship goals. Are you a goal setter? Do you think about goals all the time, or do you just kind of say, well, let's see where this goes? Like, where's your mind?
This is not see where it goes. There are definite goals. There are goals for sure. So for medicine, it was get through training. Whatever happens, get through training, then you can figure out your life. So that was my like tunnel vision. And as much of dance I could fit in, I did. But now that I've finished, I'm tempted to give dance a bit more attention and focus on other things. So I think I would say have some short-term goals and some long-term. I know maybe a lot of people say this, but it really works. Even if it means I want to get better at this, whatever skill it is, you know, by this month, I want to be able to do this. So I want to have taught so many classes, or I want to try and hit these many numbers. Give yourself a goal, because at least you need to be accountable to something or someone. Otherwise, you're just going to get complacent, I think.
Yeah, super important. Numbers are important. Like, it's one thing to say, oh, I just want to get better at this. But put a number, put a target, put a date, put an aim, and then you know, think about it all the time, write it down, whatever, just to drill it in. So numbers are very important. A lot of time people say, oh, I just want to pass an exam. And we talk about, no, goals, set yourself a goal 90%. Like that will draw you.
I still remember you saying aim for 100. Why are you trying to lose a mark?
Yeah, because it's about that goal, isn't it? And if you aim high, even if you don't hit the goal, you're still more than happy with what you got.
Mm.
Whereas if you just want to, if your aim is to get better, then you just haven't got that pull. Like it's on that difficult day where you can't be bothered, that's not going to pull you. Whereas if you think, 90%, that's going to pull you. Even when you don't feel like doing it, it's going to pull you. And secondly, you said accountability, which is super important. Telling somebody what your goal is. Like there's something so powerful about telling somebody else what you want to do, because if you don't do it, you've got to explain why you haven't done it, or you've got to come up with an excuse, and that's going to pull you even further. And then being accountable to yourself, you've got to have that discipline that, if I don't do this, then I'm going to almost not punish, but I'm not going to be able to do this, for example, or I don't get this reward.
Yeah,
and that's very hard to do.
Yeah.
Very hard to do.
Yeah.
So you used accountability, which is great. Your goals were high, which is good. Give us one other tip that you could think about someone who is a clinician or a medical student or a junior doctor or a GP trainee, but they just want to do something else. Like what's, apart from setting the goals high, getting clarity, knowing why you're doing it, give us one other thing that you've learned that can help them jump into it.
So one of my other things that I do is I train a lot of medical and dental students for interview prep for interviews, right? And you see this whole passion in them. I do this, I'm in debating society, I'm a captain, I'm this, I'm that. They have so many arms to who they are. And then they go through med school, and then you see consultants at the end. And I'm sorry for generalizing here, but a lot of the consultants I've seen in hospital, majority of them, would either not be too happy in their job, or would talk about how they want to get out of it, or how they're trying to, the rest of it. And I used to always think to myself, what happens in the middle? Where does that excited person go? What happened to their journey? So I would just say, find something that makes you excited about life, because it's such a privilege to even be alive. If you have a gift or an art that you can give to the world that will live beyond you, you need to just do it. Even if it's for yourself, or, like I said, leaving something behind after you. Someone said something to me when they were like, I was talking to someone and he said, what I do, if tomorrow I didn't turn up to work, they would just replace me. They would just call another doctor and replace me. But if you stop doing what you do, it would be a little more difficult to, and, I don't think he was trying to blow my trumpet, but I think I was going through a lull and he was trying to motivate me.
Yeah.
And it really stuck with me. And I was like, wow, that is the power of art and creative, whatever, writers and cinematographers and the rest of it, because what they do lives on.
Yeah.
Obviously what clinicians do too, because you're affecting lives, but do you know what I mean?
Yeah.
In terms of an actual form. So I would just say, really find something that excites you and just do it. Just start more than anything else. Don't overthink it at all. Just start. Yeah.
Yeah. And that legacy that you're talking about is a driver for a lot of people. And if you are passionate about something enough to think about the legacy you're leaving behind, again, you're in the right space. Then if you're worried about how people will view this in 20, 30, 40, 50 years when you're gone, then you're thinking about something that you really are passionate about. If you're thinking about, well, in 5 years, how much money am I going to make from this thing? Then you're probably not on the right track. You're probably going to not follow it through, because your initial thoughts are not kind of at the level that's going to drive you.
Definitely. And it's not easy being in the arts. And I think we've talked about this before, where with academics, the effort you put in often equates to the result. If you really work hard, you get the merit, you get the distinction, you get that scholarship. But with the arts, it's not really like that. You could work your ass off on a, movie or a video or whatever. You may think it's great, but it may not do what you wanted to do.
Yeah.
And it's a very humbling experience. And something
100%.
you just did off a whim could get millions of views, and you just think, what the hell just happened?
Yeah.
So I have so much respect for like actors, and a lot of my close friends are actors and in the industry full time. They've given up their day job, they're braver than me. They've stopped it and gone for it. And there are months where they have no work, no work. And that mental strain on them, But then there are months where there's lots of work and it's a whole different personality molding, isn't it? It's a whole different thing.
Yeah, absolutely. And I resonate with that point completely. And I've kind of mixed the two. So I obviously make videos on medicine. So I sometimes think, oh, that's an amazing video and that's going to help a lot of people. They're going to love it. And no one watches it. And then I make a video and I thought, you know what, that's rubbish. But I'll put it out because, why not? It's got some good points. And it's the one that gets all the comments and all the likes. So absolutely, like you said, you never know what's going to resonate with people. And sometimes you put in loads of work and you've got to be prepared for, actually, it's not giving you the rewards that you want. But that doesn't mean that you stop the journey because you're so passionate about it. You just move on to the next one.
Yeah, you just realign or just move. Yeah. And monetary thing, unless it's actually a service you're giving, I think it's about the passion, and money will come. Like whoever's here listening and wants to do this, I promise you that will happen later, but you need to put in things first.
Yeah. And get the groundwork in right, get the thinking in right, get the clarity in first, understand why you're doing it, and then everything else should take care of itself.
Yeah.
Amazing.
Agreed.
Amazing. So just a quick reminder, when did we meet? We met at the AKT course. How did you find that? It's a long time ago.
Oh yes. Oh goodness. I look up to you on so many levels. I can't even begin. It was not last year, the year before. It was on the AKT course, an exam that I was very underprepared for, which I failed, and then ended up doing both my final exams in August of last year and finishing. But I know I've said
by the way,
before.
guys, watch the video on YouTube, because we go through that in detail, how she did that, how she got into a position to be able to do 2 big exams, RCA and AKT, within what, 2 months?
Yeah,
2 months. Yeah. So go back to the YouTube and watch that video. Sorry, Karen.
Yeah, no, I was just going to say, I think more than anything, I always say this to you, it wasn't that you were trying to sell products to students and things like that. It was all of us when we were panicked at 10 p.m., 6 a.m., messaging you like crazy people. And I'm sure people are doing it to you now. The fact that you never made anyone feel too small or too irrelevant, where our own PDs and supervisors didn't have time to kind of console us. I feel like people like yourself and others on the field who are educators, you really, stood true to what you stand for. You're not just there to kind of sell a service. You actually care about how people come out, on the other side. And I say that to everyone now that I meet, that actually everything he sells is actually quality, because it's it's a certain standard for sure. So thank you.
Well, that's really kind. But that's where the passion comes from. Like that's what I love doing, and I love seeing people succeed, particularly if they're in a difficult situation and they're struggling to get through an exam. And any input that we can have often is not knowledge, it's not imparting knowledge people can do themselves. It's that confidence and belief.
It's just that belief. It's just that belief, because it gets to a point where you lose belief in yourself, and it's just that belief. And now when I look back at that phase of my life, I will never forget it. I will never forget who was there for me. And imagine how many students feel like that about you guys. Do you know what I mean?
Well,
so that's legacy in itself.
Well, that's why I certainly do it. That's why I love doing it. But thank you so much for your time, Veena. I think people have hopefully got a huge amount out of this. And I'm sorry we couldn't answer every question. And thank you for everybody who's commented. And we had so many people watching today, which is great. And we're going to get this out on YouTube and Facebook and everywhere else, so you can watch back if you haven't. For everybody who watches our Instas, we always do a discount on our Insta Live. So if you want to use any of our products, guys, this is AKT, RCA, PLAB, MSRA, Medical School, please use the coupon Aurora Insta 10, ARORAINSTA10, and that will give you 10% off anything on the website, auroramedicaleducation.co.uk. Veena, what are your handles? Where can people find you across social media?
My Insta handle is at Dr.Veena. And
follow now, by the way.
And on YouTube, if you ever want to watch the dance videos, it's Ivy Dance.
Watch them. They're really amazing. You can see where the passion comes from, and where the skill comes from as well. So Veena, thank you so much for your time.
Thanks,
I'm sure
Aman. Thank you so much.
We'll get lots of questions, I'm sure, following this, and maybe we'll do one of these again in the future when you're even bigger of a star.
Oh, I don't know. I don't know. Not nowhere, anywhere. But yeah, thank you. It's a journey.
Brilliant.
Thank you so much.
Thank you, Veena. Take it, guys. Thank you, everybody. Bye.
Bye.